Good morning. This is Tom Wilder with the North Carolina Department of Labor, and welcome to Occupational Exposure to Bloodborne Pathogens. Hopefully everybody's having a good day today. Of course, like I said, it's warm in Raleigh. I live in Sanford. A week ago today, we had 5 inches of snow in Sanford, and we got temperatures as low as -4. So today we're, of course, a lot warmer and have rain. It's a good day. And again, welcome to our class. Uh, for those of you who attend our webinars, you know they last up to an hour and a half, and you'll receive an hour and a half credit for the webinar that you can use for certifications such as MESH. And like I said, most of you know me, but for those of you that do not know me, I've been with DOL about a little over 5 years, and prior to that, I worked 28 years in various safety training and quality management positions in textile, machine assembly, and the pharmaceutical industry. Most of those years were in pharmaceutical manufacturing, from which I am now retired. So anyway, sometimes I'll give you examples, and many times they'll come from the pharmaceutical manufacturing industry where I spent most of my time. Like I said, if you want more resources on bloodborne, you can go to labor.nc.gov or osha.gov. There's a ton of information out there, and hopefully you'll learn something from the session today that you didn't know before. Logistics for those of you who are new. Look around. You want to close your door if you have one. Turn phones off. You're in a cube. You might want to use headphones and put up a do not disturb note. We'll be using Webinado again today. That's the software. You'll see the PowerPoint slides in the middle of the screen. And at the bottom, if you scroll down or have to, you'll see the chat box where you'll be chatting with me and other attendees. And a lot of you have already used the chat box and are very familiar with that. Bottom left corner, the emoji, we will not be using the emoji. I've got more people in my class listed on my screen than I can see, so the emoji doesn't do me a whole lot of good, so don't worry about the emoji in the bottom left corner. And again, you'll be using the chat box most of the time to make comments and ask questions. As you probably already know, you have to attend at least 80% of the course to receive credit, and I'll be looking at your login times after we're through. And we can't give credit to anybody who's not individually registered and logged in. And certificates, you should get those electronically within 3 weeks. If you don't, give us a call. So all of our little logistics are finished now. So let's go ahead and get into the topic. Of course, today's topic is bloodborne pathogens. And it was introduced as a standard in 1991, so it's been around for a while to prevent occupational illnesses acquired from exposure to blood and body fluids. And of course, as a result, over all these years, it's helped to minimize the exposure to pathogens. And of course, today, hopefully, you'll understand more about the requirements for the standard. Now, before I get into the slides again, I'm going to do a couple of things. One is I'm going to tell you some things that you need to have in place if you have occupational exposure to your employees to bloodborne pathogens. If we went into your facility and we were looking around at your safety programs, we would find an exposure control plan. And we would see that you update that plan annually, that you use universal precautions, treating all human blood and body fluids as infectious. We would be looking at your engineering controls, your work practice controls, your personal protective equipment. We would see that you would be providing hepatitis vaccinations, hepatitis B vaccinations to all workers that have exposure. And you would have plans for post-exposure follow-up. We would see that you would have labels where labels are needed, like biohazard labels. You'd be providing information and training to workers, and you would be maintaining worker medical and training records. So if you're doing all these things and you're doing them per the standard, you're in great shape. And today you might find some things that you're not doing that you need to start doing, or you may be doing all of these things well. We will see. Now, one thing I like to do in my webinars, we'll go ahead and do my standard instant poll. So the first question I want to ask is your experience level with this topic. With bloodborne pathogens, what is your experience level? So let's go ahead and start that poll. And most of the time we'll have a mixed class. We'll have some beginners and we'll have some experts and we'll have some folks in between. So this way, if you're a beginner, don't feel too bad because there are 19 beginners that have logged in as a beginner and 6 intermediate and 7 advanced. And sometimes I'll have somebody in the audience that knows way more than I do. And I appreciate that. We'll share as much information as we can to make sure that we cover the topic well. Okay, so we have a good mixture of experience with bloodborne pathogens. And just for your advanced and intermediate students out there, we will get down to the basic level for our beginners. So hopefully I won't bore you too much, or at least show you what you're already doing in your program. So I'm going to go ahead and stop that poll and close it and ask my second question, which is professional safety experience. I always like to know that. So let's go ahead and find out what our experience level is as a safety professional. Like I said, all good instructors need to know what their class is made up of so that they can tailor their training to the audience. And like I said, we have a broad audience with experience with bloodborne. And as you can see by this poll, we have a broad level of safety experience. So we got some, it looks like we've got some new safety professionals and on up to senior and advanced senior and super senior level safety professionals. All right, so let's go ahead and stop that poll. And I'm glad I see you got some comments about audio. I'm glad that you're giving some feedback. It looks like our audio is working okay. If you have audio problems, it may be on your end with your equipment. And also, some people with mobile devices may have difficulty with this presentation. If you're on this presentation with a mobile phone or a tablet, it may or may not work well with this software. So sometimes people have some little glitches with the mobile devices, and I can tell who has mobile devices, and sometimes they work well and sometimes they don't. So if they don't, a computer usually works better with this software, a regular computer. Okay. All right, it looks like our audio is working fine. So we're going to go ahead and get started with the topic and advance the slide. So we're going to give you an overview of the standard and talk about the OSHA requirements, as you might imagine. And you'll be pleased to know that I'm not going to read every word on the slide. I would probably kill you in this presentation if I read every single word. I know that you can read faster than I can speak. And this presentation is very large. I know I'm looking, it's about, see, I've got about 83 slides, so it's quite a few slides. Okay, so that's our objective. And this slide tells me who this standard is required for. You have employees that have occupational exposure to blood and potentially infectious materials. If you have any potential exposure, this standard applies to you in every way. If you do not have potential exposure, this would be kind of like a best practice for your company or employer. But if you have potential occupational exposure, then again, it applies to you. Now, let me ask the question to the audience here. Tell me whether you have occupational exposure with your employer. Do you have exposure? I want to know who has occupational exposure or not. Okay, Michael says no. Jimmy, no. Trey, yes. Right. Potential. Now, what I mean by occupational exposure is if people had no protection on, they could be exposed to blood and body fluids. Okay, first aid, typical manufacturing. So I would say in many cases, and probably most of our audience today, has potential occupational exposure. And with a regular manufacturer, for most companies, who has potential exposure? Who has, with most companies, who has potential exposure? Okay, hospitals, janitorial, okay, janitorial, medical, first aid. Now, it looks like I've already got a couple of questions, so let me, firefighter, those are all great answers. All right, we've got a question here. Colleen asked, my HR says we are not required to have a bloodborne program since we are within 4 minutes of the hospital. Is this correct? Okay. It doesn't, well, it, is anybody going to treat or interact with that? Let's say, is there anybody in your company that occupationally is required to handle a first aid incident involving blood and body fluids? Is somebody, as part of their job, required to be a first aid responder or handle an incident? Now, the distance or minutes to the hospital isn't really the key indicator. Now, a lot of times we're thinking about first aid, provision of first aid, but I'm going to get into this a little bit more here in a minute. But if you have employees who are required to provide first aid, or employees are required to clean up after an incident, that alone would trigger the requirement for a bloodborne program. Now I'm going to get into that a little bit more, but that's my answer for now. And again, we'll get more clear as we go. Okay, Jeanette says my business is not open yet, but I will be opening a laundromat. So I would say yes. Okay. Now in a laundromat, you may or may not have people that are occupational exposed. Now, with a laundromat, what's interesting is a laundromat may be processing laundry that's coming from a medical facility, or you might get laundry that comes in a biohazard bag. So in the laundry business, um, it depends on what kind of laundry you're handling and who is it coming from, and is there any potential exposure from that work. Now, Colleen, you made a good comment. People who clean up bathrooms. Now, if you look in the OSHA standards and look at the letter of interpretations, just because you have people that clean bathrooms alone, that does not require a bloodborne pathogen program. If all they're doing is standard work, cleaning up bathrooms and following proper procedures, they do not. Now, it is a best practice. If you have people that clean up bathrooms, you want to put them in a program, that's great. But cleaning up bathrooms alone does not trigger the standard. Now, hospitals, obviously, janitorial, sometimes medical, first aid responders, we're going to be getting into times where it is required or not. Cleanup crew, like Mary says, for incidents. Firefighters is obvious. University, it depends on how things are set up. That can get a little complicated. EMS and police, or EMT and police, obviously people. Brenda, sorry that you're having audio issues. Um, hopefully everybody else is able to hear me. Now, again, Dan says you don't have to have a program if a hospital is nearby. You would have to prove, the key is proving that there's no potential for occupational exposure. Let's say I had a company, let's say I had let's say I had an office building and people were doing office work. And let's say there's a hospital next door. Okay. Now, the first aid requirements are triggered by time, response time, distance, and all those sorts of things. In many and probably most cases, you're going to have to provide first aid in some way. Now, if you had an office building and you offered first aid CPR training to all employees, and you had coverage, but it was not a collateral requirement of any employee to treat or respond to anybody, if there was no requirement to treat and respond, I'm talking about requirement, if there was no names on the board, call this responder, or these people will be covering this floor, this shift, if it's not tied to the company in any way, then you would not have to have the program and hepatitis shots, whatever. Now, in our pharmaceutical example, we had collateral duty first aid responders. We had a first aid responder list and their phone numbers. We had coverage for 3 shifts. These people were named and they were required to respond and treat victims. In that case, absolutely, we had to have the whole program, the hepatitis shots, the whole deal, because that's the way we had our first aid program set up. And we had our cleaning folks, our janitorial staff, they were charged with cleaning up after a first aid incident. So both groups were in our exposure control plan and in our program. We had no other employees that were occupationally exposed. We didn't have a nurse, anybody else. Now, Denise, I see that you say that your business is a tree service business. Now, when you go into the OSHA standards and so you see requirements for first aid on arbory or logging, if you see a requirement for first aid and train people in first aid, that's a collateral duty, that's part of your job, that would trigger the standard. Okay, all right. So I got a little bit sidetracked there. Is everybody good to go right now? Any more questions right now? Okay, looks like we're good to go. And we'll take questions and comments as we go. And sometimes it can get a little bit confusing. Now, we're going to talk about all types of occupations. Now, healthcare facilities are typically covered, like your hospitals. You know, hospitals a slam dunk for bloodborne pathogens having a program. Non-healthcare facilities. Now, also healthcare, we can talk about dental offices, blood banks, but non-healthcare facilities you've already mentioned. We have law enforcement, we have firefighters, and we have permanent and temporary work sites. So you have rescue scenes, crime scenes, and again, collateral duties. Exposure that's part of somebody's job, but it's not their main job. So a nurse or doctor would have exposure as part of their main job. I mean, that's pretty much what they do. But again, a collateral duty first aid responder could be an accountant, but they're on a first aid response team, So that would be a collateral duty for the accountant. Temporary operations, like I said, trauma rescue scenes, blood banks, crime scenes, again, collateral duties. That's pretty straightforward. And you have multi-employer work sites, employment agencies, personnel services, home health, independent contractors, and independent practices. Now, a lot of you can have independent radiology contractors, independent emergency response companies, and of course, independent physicians. You can have a physician that owns their own business, like an independent practice, like, again, a physician. Now, the people that are most at risk, most of the time, are the people on this list. This is the core of the highest level of frequency and exposure to blood and body fluids in all these types of work. Now, dentists and dental workers are covered because of saliva. Now, saliva, why is that the trigger for a bloodborne? Why is saliva a trigger for bloodborne pathogens? What is it about? Okay, it can contain blood. Perfect. OPIM, other potentially infectious materials. Great answers, Brian and Van. So that's the trigger for a dentist. Laundry, again, it depends on what kind of laundry you're processing. Some people are contracted to perform laundry services for medical practices or those sorts of places that the launderer would get and receive laundry that's specially bagged, whatever, for processing in the laundry. Now, like I said, a needle stick, of course, that's an exposure. If your job involves needles, you can have a needle stick, that would be a trigger. Your lab workers, your medical technologists. My mother was a medical technologist for years, so she worked in a hospital lab. Your nursing home and dialysis personnel. Now, in North Carolina, we have a regulation. It's North Carolina Administrative Code. Now, law drives this regulation, and it's in the front of our North Carolina standards books. Our North Carolina standards books have the federal regs in them, but in the front of those books, it has the North Carolina regulations. Now, what this says is if you have folks that have potential occupational exposure and they're working in construction, that's a trigger for the bloodborne program. So if you're performing construction duties and you have collateral first aid responders, that's going to trigger the requirement for a bloodborne program. That's something that North Carolina added on to the federal requirement. All right. Now, the definitions in the standard, we're going to go through all of these. So these are pretty standard. So let's go through them one by one. Now, when we say blood in the standard, we always mean human blood or components that come from human blood or products that are made from human blood. So again, blood from other animals besides humans doesn't trigger the standard. So if you're a veterinarian, the blood from your dogs and cats and other animals does not trigger the standard, but you would expect that even veterinarians would be using the same type best practices to protect themselves. But the blood from other animals does not trigger this standard alone. Now, these pathogens, the word pathogen means that it could cause disease. And the three most common are hepatitis B and C that cause liver disease, and HIV, which most of us know causes that compromises our immune system. So those are all viruses. One thing about viruses are very tiny. Viruses are much smaller than bacteria. And one thing that's interesting about hepatitis B virus is hepatitis B, if a surface is contaminated with hepatitis B, it can remain essentially a threat on that surface for days. Now, viruses typically don't survive very long on their own, but hepatitis B will stick around and become infectious even days after a table surface is contaminated with blood or body fluids with hepatitis B uh, in it. Now, hepatitis is a liver disease, and we list 6 types of hepatitis: A, B, C, D, E, G, that are viral. But the bloodborne ones are B, C, D, and G. And symptoms of hepatitis: jaundice, fatigue, nausea, that sort of thing, and can also be fatal. Now, HIV, we know that it can lead to the disease AIDS, where the body's defenses are compromised, leading to a body receiving other infections, which could be potentially fatal. So we're going to protect against that. And we also have all these other bloodborne pathogens: malaria, syphilis, a lot of these others that have fancy names, and they have to be converted to things like mad cow disease or these other types of diseases. So these are other pathogens of concern besides what we call the big three: hepatitis B, C, and HIV. Now, other potentially infectious materials. Does your job require you to come in direct contact with anything on this slide? These types of body fluids. Now, if you're not a dentist, people that are doctors or surgeons, they're the ones that are the uh, most at the most risk. So these are called OPIMs, other potentially infectious materials, that can contain these pathogens that we're worried about. Okay, and a lot of you in your workplaces, you're never going to come in contact with anything on this slide. But if you're in the medical business, there's a good chance. Now, if somebody says a surface is contaminated, you've got blood or one of those OPIM listed materials from that last slide on an item or surface. So this one thing I learned years ago. I worked in a chemistry lab. You know, if a lab bench was wet with anything, we didn't ever put our finger or hand in it. Not only, I don't know that we would run into biohazards so much in that chemistry lab, but we never touched anything we didn't know what it was. So we would always take precautions. For chemistry safety, we would always take precautions. For chemistry safety, as you would for biological safety here. Now, okay. Blood, okay, Mary asked, what about blood or urine on bath stalls? Can that be a problem or concern? Certainly, it can be a problem or concern. Now, if you go to Federal OSHA after this webinar and you go into the standard and you read the letter of interpretations from Federal OSHA, people that work in, now we have hygiene, feminine hygiene products and proper disposal of those and things that you might run into in a normal bathroom. That alone, again, is not going to trigger a requirement for standard, but a company, even if they don't have a bloodborne program, even if they don't need one, they're going to give their janitorial workers personal protective equipment because they don't know when they're going to run into some rare blood, for example. Urine may or may not be an issue, But from a health perspective, they're going to be wearing personal protective equipment. So it can be a problem or concern. But if it's a normal restroom and it's not in a hospital, um, again, those people that clean up in there, as long as people that use the restroom and all use proper procedures and proper cleanup methods, uh, they would be fine. But you would want to tell those employees that if they encounter that, to protect themselves. Okay, now somebody comes to, let's say you're a safety professional, and somebody from your facility comes to you and says, we had an occupational exposure to blood and body fluids. Now, occupational would mean this has to do with their employee duties, but the exposure can only occur from non-intact skin, like the skin is broken or punctured, through the eye, mucous membrane, mouth, or parental contact was like injection. So don't treat everything as an exposure. If somebody's bleeding, nobody's exposed. People clean it up properly with personal protective equipment and dispose properly. There is no exposure. Now, let's just take a regular company. Let's don't think about doctors and hospitals and doctors' offices and dental offices. Let's think about an office building. There's no nurses aren't there. These are just office workers, professionals, accountants, secretaries, whatever. They do work all day long. Now, what could happen in an office building that could lead to an occupational exposure? And I'm not talking about somebody getting hurt either. What can happen that could lead to an occupational exposure? Just, okay, nosebleed, that's good. Fall, okay. Now let's say things that aren't initially injuries. Now somebody's hurt or they're having a physical problem there. What event can happen in any workplace that could lead to an occupational exposure? Any workplace. Okay, vomit, okay. That's a physical thing from another person. Okay. Let's say you work in a kitchen. What can happen in a kitchen? Sneeze, cut. Okay. People could be cut by knives. Okay. Scissors and knives. Okay. Now, what else could cut you? Oh, thank you, Rebecca. That's what I'm looking for. Broken glass. Okay. This can happen anywhere. Somebody's walking down the hall. They drop a Pyrex dish. They drop a glass. They drop a plate. And what's the wrong thing to do? What's the wrong way to get that glass up? Bare hands. That's right, with hands. People are very careful to pick it up with their bare hands. And some of this glass, when it breaks, has shards. And you'll cut yourself. You cut yourself, you have blood, you have somebody helping you. They get into your blood with a sharp, broken glass. You've got occupational exposure right there from broken glass. Okay, now love your answers. Vacuum should be used. Should use dustpan, Brian. Thank you. Now, a lot of companies, this sounds kind of funny, but a lot of companies have safety rules. You work for a company or an organization or the government and they have safety rules, and you read this list of safety rules and you sign it and say, okay, I'll follow the rules. Some companies in their safety rules, they say in case of broken glass, do not get it up without using engineering controls. And then what they mean is broom and dustpan. And you're going to dispose of that glass in a way that whoever's handling the broken glass later, taking out the trash or whatever, doesn't get cut. So broken glass is a sharp. So when we talk about sharps, broken glass can be a sharp, again, because it will cut somebody and they'll allow a pathogen to get into your body. Now, the last thing I'm going to say on this slide here is, okay, let's say somebody beside you cuts themselves and your arm gets splashed by their blood. Your arm. Let's say just say between your elbow and your wrist, you get splashed with blood. Is that an occupational exposure? Right, Michael, it is not. It sounds like one, Brian, right, unless broken skin. It depends, like John says. If skin is intact, no. Must be broken skin or open wound. These are all great answers. So somebody's splashed. There's no route of entry. Now, what should the person that splashed do? What's the first thing they do after they're splashed? Yeah, they immediately wash and clean up. Exactly. All right. Great answers. Now, this slide are pretty much already covered. Now, Dan says, what about absorption? Now, if somebody immediately washes, I don't know if they've done any studies out there. Yeah, you would have an issue possibly with absorption. Let's say I have contaminated blood and I put it on my skin and I let it, and let's say it's a volume of contaminated blood on my arm, and I let it sit there until it dries for hours and hours and hours. I would think there would be a risk there. But with standard practices of people washing immediately, I don't know that we've ever had a case in this country to prove that that happens. Would not be enough to justify the testing. Right. Okay. Now, here's another great slide. Regulated waste. Now, one thing funny, we're state OSHA here, or a state plan state. OSHA typically is not in the waste business. When you get into who regulates waste? Who regulates waste? EPA, okay. Who else gets involved in North Carolina? The state, DENR, which is now DEQ, DHHS. They all get into the rules for waste. Okay, now, and then you have transportation too, rules for transportation of waste. So it's regulated if your waste is in a state where it can be released or infect somebody. It's in a liquid or semi-liquid state if compressed, or if it's a pathological waste like from surgery, contaminated sharps like syringes, needles, lancets, those sorts of things. And it has enough non-dry OPIM or blood to release pathogens, or it's liquid or semi-liquid blood. Now, I want to give a simple example. You're at work, you work in an office, and I know all of you don't, but say you work in an office and you get a paper cut. That happens quite often. You go to a first aid kit, you get a Band-Aid, and it's a tiny paper cut. It's just barely bleeding. And you get a Band-Aid, you put that Band-Aid on. Now let's just say that Band-Aid, let's say you had that Band-Aid on your finger for days or a day or whatever. Now, When you eventually take that Band-Aid off and that Band-Aid is dry, is that Band-Aid regulated waste? No, no. You can throw that in a regular trash can. You're not going to get in trouble for that. Now, some of your companies have very strict programs that go beyond the OSHA standard, and you say, we want all your Band-Aids to go in a biohazard bag, okay, and be treated as biological waste. If you work for somebody that's strict, that's fine, but the standard says that blood that's dried on a Band-Aid is not going to cause a risk or hazard to anybody handling that dried Band-Aid. And Keith says we double bag all items with blood. That's great. And we'll talk about bagging and all that later. Now, let's say you work in a doctor's office and you got sharps containers. Now, I know some of you may work in doctor's offices. I may have some of you online, but in every exam room, typically they'll have a sharps container for all the needles and syringes, lancets, and all that. And when that sharps container is full, it has to be disposed of properly. And I'm going to ask you an interesting question, and this is not per the OSHA standard because we're talking about waste. In North Carolina, can a organization dispose of a properly closed sharps container in a landfill? In a landfill. And I'm still looking at the answers. Guess what? Brian's got it, John's got it. The answer is yes. Now, before we overreact here, that's kind of like a trick question. I'm with all of you. If I'm a company, I would never send those out that route. They would go to a biological waste incinerator, they'd be properly treated, whatever, burned up, whatever. But in North Carolina, generally speaking, it is allowed, but not a good, like Brian says, not a good practice. Does that mean that all landfills are going to accept them? For all landfills? No. So generally speaking, if they're allowed to do it, the landfill can decide what they're going to accept or not. So don't assume that all landfills are going to do that. But you know, with most of you that said no, I thought no for many years. I'm right there with you because I was surprised that it would ever be set up that way. Special companies have to pick it up because the handling of all those materials, you know, could pose a hazard to their employees. So you just can't let anybody pick that stuff up because that's out of control. If your company that generates biological waste and somebody gets hurt downstream as it's going toward waste, you know, there could be some liability there. So for lots of reasons, you want to use a special company. You just don't want to hire somebody to come pick it up. I mean, they might just go out in the country and dump it somewhere. So you really couldn't trust that because we can't ever relieve ourselves of liability with some of this stuff. It's like hazardous waste, cradle to grave kind of thing. So that's the deal on waste. Now, let's keep moving. CSIPs, sharps with engineered sharps injury protection. These are sharps or needles that have a built-in safety feature to protect the user. Now, if you're in the medical field, you're going to see some safe devices for infusion therapy. Now, most of you don't perform any infusion therapy at your workplace unless you're in the medical field. But infusion therapy, you're delivering medication to a patient using needles, cannulas, or, uh, needles or cannulas, and catheters. Needles, cannulas, and catheters. Now these are special uh, devices here that are safer for people that do that than other devices that are out there to do the same thing. So if you work in a doctor's office and you're buying devices for infusion, there are safer devices that meet CESIP requirements. It's like a syringe with a retracting needle, and that's like this one here. You administer the shot, and you push on the plunger again, and it retracts the needle inside, so that you're not going to stick yourself or anybody around. You're going to take that device and put it in a sharps container. Phlebotomy. Now, most of you probably don't collect blood, but there's safety devices for phlebotomy. And these lancets, these tubes, collection needles, they're all safer devices. Lancets. Now, we use these to prick ourselves to sample our blood, like say diabetics, whatever. They're lancets that are safer for the people that have to test other people's blood. So those are safety lancets. Scalpels that are disposable. So you undergo surgery, and we have these disposable safety scalpels, like this one that's shown here. And if you can go to something that's needleless, that prevents a needle stick, that's safer for collecting body fluids, administrating medicine, to prevent any exposure from a contaminated sharp. So needleless systems, again, a lot of you don't have to worry about that because of what you do. But those of you that have potential exposure, you're going to have an exposure control plan for your company or your location. And what that does is a plan required by OSHA that goes through your entire bloodborne pathogens program, and it talks about who's exposed, how do you treat incidents, what do you do if somebody is exposed, what about the hepatitis shots. It goes in the whole bit. Now, I will tell you that North Carolina Department of Labor at labor.nc.gov, if you go to our website, we have some templates. They're like Word documents that you can download and fill out and make them customized for your company or organization. So if you're having to put one of these plans together, you don't have to start from scratch. Go get our template, customize it to make it your exposure control plan. And it talks about how do you determine exposure? What do you do if you have an incident? Now, this plan must be accessible to all your employees if they want to look at it, and it has to be reviewed and updated annually. Now, this is one of the biggest issues we run into when our compliance officers go out to do an OSHA inspection. They'll ask some questions. Do you have occupational exposure to blood and body fluids? And the company says yes. And they say, do you have an exposure control plan? Yes, we do. You're welcome to review it. Do you review it and update it annually or when changes occur? No, we don't. We hadn't looked at it. We wrote it 5 years ago. We hadn't changed anything. We hadn't even looked at it. Well, that would be an issue for sure. The OSHA standard requires for that to be reviewed and updated annually, and to talk to the rank and file people that are occupationally exposed. because you have changes that occur, or you may need to be going to some safer equipment or supplies, whatever you've got. It needs to be done annually. Now, besides the annual review of your exposure control plan, what else has to be done annually? What else has to be done annually? I'm letting all of you respond. Training. That's right. Now I'm going to talk about training for a second. Then I'm going to go back. I think I got a question. I got to scroll back to. Now, we run into issues with this all the time with the bloodborne programs out there. Now, we're education, training, and technical assistance. We'll have a company call us and they say, can you do some education or training on bloodborne at our site? I said, yes, we'll be glad to come out there and cover the requirements of the standard. But my training doesn't cover everything you do. I don't talk about your protective equipment, your procedures and all, and your exposure control plan. And they said, last year for training, we saw a video, and that's all we did. And I said, well, that's a real issue because the video, if it's a commercial video, is not site or company specific. Your training has to relate to what you do, what your company does. So when you do your company specific training, that's a good time to build onto your session and go through your exposure control plan and do the review at the same time. So that's what I like to do in the industry in the old days. We do our training, and for the people that need to review the exposure control plan, after the regular training session, we do that review and document that we did that because that is a requirement. Now let me go back. I think I had a question. I think I had a question. Okay, here we go. I'm scrolling through the chat right now. Mary, what are the rules for cleaning crew who clean up at training facilities that perform testing, dissection of animals, cleaning crew at training facilities? Okay, but are not trained to handle these types of hazards. Should they have trained staff on hand to handle these hazards? Okay, that's a good question. Now, I would have to know more about, we're talking about training facilities. Now, if it's just education, they have a room and all they're doing is showing PowerPoint or looking at books and that sort of thing. That's one thing. But if you've got a training room and they're actually doing real live dissections, now if they're animals besides humans, that would not trigger the bloodborne standard, but it would be a hazard. But they should have staff on hand to handle those particular hazards. I would say yes, they should have trained staff on hand to handle those hazards. They should not put some other company at risk for coming in and cleaning up blood and body fluids of dissections and those sorts of things without special training and precautions. That sounds like really interesting situation. Now we do have some standards officers. If you want to get real specific with that question, you can send it to ASK. I gave you a general answer, and let me at ask.osh@labor.nc.gov. If you want to get real specific with your question and all, then send that specific question in detail to our standards officers at ask.osh@labor.nc.gov, or you can call 919-807-2875 and ask for a standards officer to discuss your case. It sounds to me like something needs to be done for sure. Does it trigger the Bloodborne standard? What kind of animals? All that kind of stuff. Do they clean and disinfect before your people come in clean? Lots of questions there. I would go ahead and follow up with us with a call or an email and get a specific extended answer, but make sure you send in as much information as you can. Okay, let's keep going. The exposure control plan must be accessible to your employees in OSHA and any other government regulator like NIOSH who does research for OSHA, reviewed and updated annually. And it must include changes to the plan, and that you considered safer medical devices if you're medical people, and you solicited the people that do the work, that you didn't have just a bunch of managers in a room changing it, because the people that handle, say, patients, they know the most about the risk. Now your plan is going to talk about people that are exposed, the groups of people that all have occupational exposure, like doctors, nurses. Some have exposure like collateral first aid responders. And you're going to talk about all the things that people do where you could have potential exposure. Let's say if they didn't have any protective equipment on. So like, say, janitorial staff might say, the only time I have potential exposure is when I clean up after the first aid responders. Okay, so you're going to comply using different methods, and we're going to go through general engineering, PPE, and housekeeping now. Universal precautions means that in your program, you're going to tell your employees that we treat all employees as if they're carriers of disease, essentially, because they may not know, the employees may not know that they're carriers. So regardless of their title, their pay grade, or anything, we're going to treat everybody the same. We're going to wear protective equipment, follow our procedures, no matter who the victim is. So that's universal precautions. Now you're going to have controls, like engineering controls, like safer, if you're medical, safer syringes, and try to get the best, safest equipment you can. And you're going to evaluate those devices and tell employees how to safely use and dispose of them or clean them if they're re-cleaned. Now, when you evaluate your exposure control plan, you're going to document that, and you're going to review everything. And if you have new devices, you're going to train your employees. And engineering controls, like I said, needleless systems, CSIPs, puncture-resistant containers, recapping devices, biosafety cabinets, and mechanical pipetting devices. Now, you might think this is kind of funny, but in hospital laboratories years and years ago, they used to pipette by mouth in a laboratory. So anybody that's ever worked in a laboratory, you don't pipette by mouth, because if you make one mistake pipetting, you're going to suck in that dangerous biological material, or in a chemistry lab, dangerous chemicals. So pipetting by mouth is prohibited. Okay, we got a comment. Dan's having technical problems, so he's gonna try to work those out. Okay, work practice controls is like procedures. It's dependent on the employee. Now, we want to head off as much employee input as we can in our controls, because that gets into behavior. Some employees don't always behave right. but there are some work practice controls like hand washing. So we're going to tell people to wash their hands properly um, after handling an incident. Even if they had gloves on, no matter what, we're going to have them wash their hands. Now, what are some rules of thumb for hand washing? Let's say when you did your training and you told people they needed to wash their hands, what did you tell them to do? Because not everybody does a good job. Okay, warm water, use soap. Okay, that's great. Wash downward, 20 seconds. Okay, that's all good. Now, nurses, doctors, people in the medical community, when they were trained, there were some other funny things that they were told to do. And wash for 2 minutes, that's great. Clean under the nails, okay. Use paper towel. They're using their paper towel or arms, elbows to get the towel out, to turn the water off, to go out the door, that sort of thing. Sing. Right, what would they sing? Tony, you're right. Dan, I think that's what you're trying to say. ABCs. Happy birthday. Exactly. Now, we've always talked about the birthday song, during hand washing. And since we're in the South, it probably lasts a little bit longer. Stairway to Heaven. You could sing Stairway to Heaven. That might take a while. But alphabet song. Now, we told employees, do that. You don't necessarily do it out loud because somebody walk into the bathroom and think you're crazy or something. But you could kind of sing it in your mind to know that you're taking adequate time to wash your hands. All right, proper hand washing. Do not bend or break contaminated needles. Now, I will tell you that the bloodborne standard has changed over the years a little bit. What did sharps containers a long time ago, let's say in the early 90s, what did sharps containers have on them that they don't have now? Now, some of you only see those in the doctor's office. You may not know. This is something sharps containers used to have that they don't have now. No, not necessarily open tops. Not a bad answer, though. I'm going to give you a clue. What about needles? Needle cutter, Dan, you're right. Needle cutter. Now, so sharps containers years ago used to have a needle cutter. Somebody would give somebody an injection, they'd stick the needle in there, they would use the needle cutter, the broken needle fell into the container, and then they would throw the syringe into the container. Well, OSHA came back later and said, we don't want people breaking, cutting needles. We don't want them bothering with that. So you won't see needle cutters on a sharps container anymore. Okay. All right. Comment from John. Okay. Now, you want to put them in the proper sharps container. And most of the ones that I've seen are proper. Now, what do our compliance officers find? What kind of problem do they find with sharps containers when they do inspections? Sometimes. What do they find sometimes wrong with a sharps container? Overfilled, Brian, that's right. So that's a problem. Overfilled sharps containers. Now we've already talked about mouth pipetting and suctioning. We don't allow that. Use mechanical devices, one-handed techniques. We don't allow employees to eat, drink, or smoke in exposure areas. Like if you worked in a hospital laboratory and it was lunchtime, you wouldn't see somebody running some samples and then lunchtime and they pull their bag out of the refrigerator and start eating. And of course, what would be worse, they'd have their bag in the laboratory refrigerator, which would be dangerous. But you don't eat, drink, or smoke in exposure area. And you can't store food and drink anywhere where biohazards are. Do you think it's ever happened? Sure, it has. And that's true for chemistry labs too. There's some not smart people out there that if you don't tell them not to do something, uh, they'll store their bagged lunch in there right beside something really dangerous that can be absorbed by the food that's right beside it. Okay, we're going to minimize splashing, that sort of thing when we're treating people, victims, whatever. We're going to use special personal protective equipment. General work clothes typically does not meet that requirement. So sometimes if you have responders, sometimes you would be giving them some kind of Tyvek cover or something to put on as they do their response, some kind of barrier. And of course, gloves here, that's a great example of a barrier. Now, what about those gloves in your training? What do you need to do with those gloves in the training? Your training. What should you do? If you got first aid responders and they're putting gloves on, show how to remove. Right, Thomas? That would be wrong to have all this PPE and they don't know how to properly put it on or take it off. Proper don and doff. That's right. So in your training, I would recommend letting them practice. They can put shaving cream or ketchup, whatever, on gloves and try to remove those without contaminating themselves. And if you want to see some proper removal, you can go to YouTube and places like that. There are lots of little videos that show people properly removing these gloves. They would pinch one with the other glove's hand to pinch the palm. They would peel it out and then take that other hand and run the finger underneath it and roll that other glove inside out and throw it in the proper container. Okay, so we see different types of PPE: gloves, gowns, shields, eye protection, mouthpieces. Okay, John says don't drive ambulance to ED with used gloves. There you go. All right, sounds good to me. Now, the PPE should be no cost to the employee, and employer must make sure employees wear PPE. So during the day, during any time, you want to watch what people do because that's behavior. Unsafe behavior hurts people more than conditions. And it must be accessible in appropriate sizes for employees at the work site. Now, what's another? Now, those boxes in this picture, I have an idea. Those are nitrile gloves. What gloves can be a concern for some employees? What type gloves? Latex, Brian. Oh boy, y'all jumped all over that. Wow. I don't know if I could type latex so fast, but you did. Yeah, you're all right. Latex. Some people have latex allergies. So when those employees are provided gloves, you want to give them something that they're not going to be allergic to. And that can also be true if they have to wear a respirator, like a half or full face to seal material. If it's made of rubber type material they'll be allergic to, you need to get a hypoallergenic respirator, gloves, anything that would not cause an issue with that employee. And PPE must be cleaned, repaired, replaced, and disposed of by the employer. You're not going to tell your employees to take their PPE home to clean any of it, because you could be exposing all their family members. We're going to wear gloves when there's any potential contact with blood and OPIM, when doing surgical vascular procedures and touching contaminated surfaces. That's common sense. And Disposable gloves must be replaced when contaminated, torn, or punctured. Now, what's a good practice? Let's say you're a first aid responder. What's a good practice before you put those gloves on? Before you put the glove on, what is a good practice? Okay, now you could inspect them. Now, in clean hands, that would go beyond the call of duty. We'd probably be okay with that one. Again, brand new gloves out of a box should not have holes or tears. Now, if they're reusable gloves, I would definitely be checking for that. But you would certainly look at the gloves when you're putting them on. If there's a tear or hole in it, you're not going to wear that glove. Brenda, you said exactly what I was looking for. Remove rings that could tear the gloves. So if you got, especially if you got the kind of ring that you know would tear that glove, you don't want to have that ring on. And there are also companies out there, some of you may have procedures in manufacturing or other operations where your employees can't wear rings anyway. Okay? All right. Housekeeping. Now, if you have a occupation where you have potential exposure continuously, where the rooms areas have to be continually recleaned, you're going to have that schedule and all this information procedures documented. So if it's a doctor's office, if it's an ambulance, you would have your cleaning schedule in there. You're not going to necessarily need a cleaning schedule if all you do is have collateral duty first aid responders. You would say you're going to do your cleaning as needed, and you're going to tell who does the cleaning. Okay, now you're going to clean and decontaminate the area. If you got a first aid incident, you're going to set up a little work zone to keep people out of it because you don't want other people to be exposed. Anything you use needs to be cleaned and decontaminated and properly disposed of sharps. Okay, so we're going to clean and disinfect. Now, some of you may use bleach, household bleach, and that's sodium hypochlorite. That's the fancy chemical name of bleach, sodium hypochlorite. Now, what do you tell people that prepare bleach solutions for disinfecting? Now, here's the concentration that you got to make it up 1 to 10 to 1 to 100. But there's something important you need to tell them. Okay, do so in a well-ventilated area. Okay. Now, that's probably not going to be a big issue, but that's not a bad thing. Bleach to water. Do not mix anything else. I'm still looking for the answer. Use Clorox wipes. Okay, you could. Okay. If I make bleach on Monday, if I make up a bleach solution on Monday, should I be using it on Tuesday? No, Rebecca, you got it. Okay, make bleach fresh daily. Make it up fresh daily. Now, when you buy bleach at the grocery store, the strength of the bleach goes down over time. Now, there's an expiration date on that bleach and all, probably a do not use date. But the strength of it falls off. So your solution that you're using, you want it to be full strength. So make bleach up fresh. But you could use some commercial product, and you can go on the EPA site, and you can use a lot of other things. Now, bleach is pretty corrosive. You might decide to use something besides bleach, which is okay. But now, if let's say Somebody bled, their blood is on the table, and we safely clean it and gather all those materials, put that in a biohazard bag, and then we spray the surface with bleach. Should I wipe that bleach up immediately? No, that's right. Okay. Uh, anything you disinfect with needs a residual time. It needs to set there to do its job. Okay, let it set a minute, okay? Now, the commercial products are going to tell you exactly how long to let it sit to disinfect. Now, we don't promote anybody's product, but I'll give Lysol as an example. Lysol spray. Lysol spray, it says to clean the air, you freshen the air or whatever. But to disinfect, it'll say thoroughly wet the surface and let it sit. And I'm not looking at a can right now, but it will say 10 or 15 minutes, something like that. It's got to sit that amount of time to do its job. If I spray the surface, wipe it right up, I may not have eliminated the risk to the pathogen. May not have eliminated the risk to the pathogen. Did not have time to disinfect. So think about residual time. When I was in the pharmaceutical industry, when we had to disinfect production areas, in our work records, we had to record our residual time because the Food and Drug Administration would look at that because they knew that if we didn't let whatever we're using set long enough, it would not work correctly or work at all. Okay, we're going to put our sharps in a proper container, leak-proof, closable, puncture-resistant, and the container should be near where the work's being done, kept upright, and routinely replaced. Common sense. And we want it closed when it's being moved and secondary contained if it's leaking. And we don't want anybody handling all this to put themselves at risk. You may need to use drums, those sorts of things, and you're going to see a biohazard. You're going to see a biohazard label on those drums. Okay. Contaminated laundry. So you may be an occupation where you routinely have contaminated laundry. You're going to put it in labeled bags. We're going to have a biohazard label, prevents soak through, that sort of thing. And these next couple of slides, I'm thinking do not apply to my audience today. If you work in an HIV or HBV research facility, there are some requirements in paragraph E. I'm just letting you know. And we're not going to go through paragraph E because I don't speak up, but I don't think it applies to anybody on this webinar today. Okay, you've got a bloodborne program. You have to offer these employees hepatitis B vaccination, typically a set of 3 shots taken over a few months of time. And it's using the recommendations of the U.S. Public Health Service. Now, the procedure and all that is not in the OSHA standard for administering the shots, but you can go on the internet and you can look at the protocol from the Public Health Service about giving the shots and checking for titer, those sorts of things. I have lots of stories about vaccinations and people not developing a titer and all, but you need to have procedures and policies in place for that. Now, I don't expect you to understand or know all that unless you're a medical professional, but somebody has to be responsible for following the correct procedure, professional licensed healthcare provider, to make sure that they're following the protocol for giving the vaccinations. Okay. Now, that's going to be free to the employee. So you look at the bottom line after it's all over with and make sure that that employee is not going to incur any cost. And it has to be offered within 10 days of assignment unless they've had the series before they've proven through antibody testing that they're immune, or they have contraindications to the actual vaccine, which some people do. Now, participating in pre-screening, not a prerequisite. If they decline the vaccine, then they can accept later. Now, this third bullet's very important. That's Appendix A in the standard. If you offer hepatitis shots to your people in your program and they decline, I would put Appendix A in the OSHA standard. I'd put it on a form. It says I may be at risk and I may get a vaccine later at no charge. I'm declining it now, blah, 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 but I can receive the vaccine at a later time, and have them sign and date that. You want to keep that for your records. If it's got to be signed, that's a certified document you need to save, because some employees are not going to accept it. And you're going to follow the U.S. Public Health Service procedures. Okay? Now, if you have, your program also has to talk about if you have a case of exposure. You have to identify your source individual. They're going to have a sample taken to see if their blood they're infectious, and the results made available to exposed employee. And so you can see the slides here talk about the protection for the employee's identity and the testing of their blood. Now you're a victim. You want to collect that sample of their blood as soon as possible after consent is obtained. And if they consent to the collection but not to the testing, you want to preserve that sample for 90 days. Of course, I don't know why they wouldn't want it tested, but anyway, that's what the standard says. Your medical professionals, they're going to get a copy of the standard, what your employees' duties were, the route of exposure, and results of the source individual blood test, and all appropriate medical records. So if you have an exposure, you're going to be following this part of the standard. And the medical professional is going to give you an opinion within 15 days. And and it depends on whether they've been vaccinated or not. And they could receive a post-exposure vaccination. Now, like I said, that's the protocol for exposure. And like I said, if you want to put it in your plan, which you should, just go to the OSHA standard, and essentially you're going to do everything it says to do. Now, anything that will contain biohazards like these is going to be in a labeled bag or container like this particular one. The employees that are affected have to be trained. Warning labels on any containers, freezers, refrigerators, or containers to ship, and have that particular legend for biohazard that's fluorescent orange or orange red with lettering or symbols in contrasting color. So, now, if you had an HIV or HBV research lab, this is the information that would need to be on the door. Now, the training, you're going to give your employee training at the time of assignment to task, and annually, at least annually thereafter. Now, the training program, a lot of that is covered under our presentation today, but a lot of that also site and company specific, like your vaccination program, your emergency procedures, your signs, your personal protective equipment, the ability to answer questions in your particular setting. That's all part of your training program, which this is right again out of the OSHA standard 1030G2 VII7. Now, the person doing your training shall be qualified, knowledgeable about the training program as it relates to the workplace. So if I came to your company, I might know a lot about this topic, but if I don't know anything about how it relates to your workplace, I might not be a good trainer, because I can't talk about your protective equipment procedures, anything. And this is information for your lab people for HIV and HPV labs. You're going to keep medical training records and a Sharps injury log. Now, the Sharps injury log, that's only if your operations involve the use of medical devices, Sharps like needles, catheters, those sorts of things. Just because you have glass in your facility, you don't have to have a Sharps log for a potential case of broken glass one day. This is only for the people that use the devices. Medical records, again, this is what a medical record must contain and must be maintained for employment plus 30 years. For the medical records, training records, this is what needs to be in there. When was the training done? What did you cover? Names and qualifications of trainers and job titles and names of trainees be maintained for 3 years after the date of training. The Sharps injury log, if you're a medical facility, it's required to keep records, like a hospital, for this. What kind of device was involved, what area, what happened, where this person was, say, received a needle stick. And it's mandatory for those keeping records under 1904, record keeping. So not everybody is required to keep those records. Okay, exemptions, I'm sorry, from record keeping, that's in 1904. And so you're not required to keep records. Some occupations, like say a doctor's office wouldn't have to keep a Sharps log, but a hospital would. So you have to look at 1904 to see if it applies to you. Okay? And anybody that's exempt from records, they still have to report serious accidents. You're going to make these records available to government inspectors from OSHA, NIOSH, employees and their representatives. And now, certain medical records can be given to the employees. Now, there's some rules for medical records, which again, we're not going to get into today, but your medical records might not be able to be looked at by all employees at the site. Now, I know I kind of rushed through that last part, but this is pretty much what we covered today. And let me stay on here for a second and see if we have any questions. Okay, Van. If you implement a first aid exempt policy at a small company, is a bloodborne pathogens program required? Okay, that's a great question. Let's say you work at a company, small company. It's not a medical company where people are routinely exposed, that sort of thing. And you don't have occupational exposure. If you use Good Samaritan first aid, and first aid is able to be provided, but they're not required to, there's no signs with names and all, it's not occupational requirement, you could be exempt from the whole thing. So, and there's certain companies that do that. If they don't have normal exposure and they have people that will respond for first aid incident, then they don't have to have the program at all. But a lot of companies will do it as a best practice, even if they're not required. So Van, if you don't have a required first aid program, even though you got first aid responders, you could be exempt. Okay, so with that said, I've got 11:29. That's certainly the end of the webinar today. And so thank you for being on the webinar today. I appreciate your time. And you have a great weekend too. John, Rebecca, Rachel, Michael. I'll go through the chat, make sure I didn't miss any questions. I think I got them all. But I think we had a pretty good session. We had a great class. Okay, I've got a question. For availability to employees considering our field employees always temporary. Oh, you're talking about, okay, your exposure control plan. I guess you mean your exposure control plan. Well, I mean, you can make it available to them electronically, whether they can connect by phone or device. You can pull up the plan from your server at your site. You can make copies of your program, let them take it around with them, have them in the trucks or vehicles. Just make it available. They may not need to carry it around all the time, but just make sure they know that they can see it anytime they want to. And with today's technology, uh, you can just about call up on a phone and have somebody pull it up right there for you on your phone. Okay, y'all have a great weekend too. If I don't have any more questions in the next few seconds, okay, I do. Sheila, can you, okay, can you confirm that you see Doris in attendance? She has a mobile device that did not display the worksheets. She, you mean the PowerPoint slides, I guess. Well, I don't know, I'm gonna have to look. I'm gonna have to look, Sheila, because she might have been on and already logged off. Okay. Denise, thank you. Bert, Rebecca again, Sheila. Um, like I said, these mobile devices, they're great, but sometimes with this software, they may or may not be able to show everything. I guess, I guess she heard the audio. She could hear the audio the whole time. You can get it for audio. I'd rather look at the visuals. But if she could hear the whole webinar, I'm pretty much okay with that. Uh, thank you, Brian. Okay. Was Sheila? Was she able to hear me the whole time? Can you hear me, Sheila? Was she able to hear the whole webinar even though she couldn't see the slides? Yes. Okay. Yeah, she's been on long enough. She's going to get credit. And tell her next time you might want to use a regular computer. You're welcome. Okay. Well, I've got 11:32. I'm going to go ahead and stop the webinar. I appreciate your time. Again, this is Tom Wilder, Department of Labor, and you guys all have a great day. Okay, go ahead and stop recording.